And then secondly, helping parents know what to think about and know about when it comes to the healthcare of teenagers. The next slide. So in terms of objectives, I've got a lot, but I think at the end of it is at least knowing what the 3 most common mortalities and morbidities are in adolescence. What are the main points that we need to know about in adolescent brain development? And also being aware of consent and confidentiality issues according to the laws of Texas and federal laws. Knowing what the difference is between health and wellness, and then everyone being able to describe why an adolescent wellness examination is important. I say this because I'm first and foremost a physician. At the same time, the adolescent age group cannot be taken care of by only doctors. They cannot be taken care of by only pediatricians or internists. It really takes, this is where the village comes in, and all of you, those of you who are present, I understand it's a very interdisciplinary group, and I'd like to put in a plug in for a leadership education program that I was trained in decades ago, and that we are funded by the federal government at Texas Children's Hospital and Baylor College of Medicine, and have such a program, a center on leadership training, where the students are all from interdisciplinary groups. And so it's something that some of you may be interested in participating in the future. Next slide, please. So what are the major causes of death in teenagers? This slide really gives the age span. And if there's one thing that I wanted to highlight, when you look at unintentional injuries, accidents, etc., they dominate when it comes to children, adolescents, young adults, and then adults up to the middle years. And I think that's a very important concept to understand. And then it floats into areas such as cancer and then heart disease, etc. Now let's focus on the next one. The next slide, please. When you hone in on the 10 to 19 years of age, yes, unintentional injuries dominate, but in there, we're looking at motor vehicle accidents dominating, followed by firearms. And then the second area is intentional self-harm or suicide. And that is up to about 22%, followed by assault and homicide, which is 18%. So what's unique about this, if we now move into the next slide, which is young adults, there's a flip where the third becomes the suicide, and the second is assault and homicide. But in unintentional injuries, there's a shift there, and what dominates is drugs, narcotics, hallucinogens, followed by motor vehicle accidents. And so I think while this may seem subtle, it really isn't. And it tells us a lot about growth and development, management of oneself, how one adjusts to various our society, and globally. The next slide, please. So the other piece that comes in, and I find a lot of people, and our politics reigns on this subject, oh, everything you're talking about, that's about urban adolescence. You know, the U of H downtown, that's urban. All of this must be happening here. Down in Dime Box, Texas, we don't see any of it. In my lifetime, I've already heard and been a part of more deaths in this age group in the Dime Box area, which is between here and Austin, a small village, as opposed to here. And rural adolescents, we have found, have a higher rate of alcohol, cocaine, methamphetamine, and inhalant use. And they're also more likely to engage in more dangerous behavior. And a lot of it is driving under the influence. And so they're in their trucks and they're driving and they die. And that's what I've actually personally witnessed as well. Very tragic. So we need to look at adolescents wherever they are. I think that's my main message. The next slide. So what are teenage health issues? We've moved from what causes them to die, and let's move on to what are health issues. In general, it's a healthy age group. And if you look at those who are ill and chronically ill, it falls under about 3%. That's not a whole lot. And then when you look at number of missed school days, the CDC reports about 6% have missed maybe an equivalent of 11 or more days of school over the course of a year, which again isn't bad. But there are areas where this may dominate a little more. Moving on to the next slide. So when you look at what the health problems are, we see mental health every day in our news. We now know that the issues of mental health are on the rise. Depression and anxiety, very, very much on the rise. Another area that is sexually transmitted infections, specifically gonorrhea, chlamydia, even syphilis, common. They account for 50% of all sexually transmitted infections among all age groups. Rise, particularly gonorrhea over the COVID. We know that we've done a good job related to pregnancy. People say that's not a disease. But if you talk to someone like me in my field, in many ways it is. At it, but the numbers with pregnancy and so are still sitting at around 21%. Think, well, what's it doing? Except maybe image issues, but the fact is that its presence has the number of girls who are suffering from polycystic ovarian disease, where because of obesity, they aren't getting their periods regularly, and there's a complete upset of their whole part of that picture. High blood that we normally would want, maybe we're used to seeing in people my age. So there are a lot of what we call old age diseases that we're seeing in the younger age group. And then sleep apnea, not being able to sleep, snoring. And so you actually don't have enough oxygen going into your brain. So during the daytime, you're sleeping more than you should. And asthma in our city, it's famous for asthma. We have a lot of pollution, and then with the pollen count, et cetera, I'm one of those sufferers. But chronic asthma is a huge issue, but it falls low on the totem pole when you look at some of the other issues we've got to deal with teenagers. Next slide, please. So then we have to move into behaviors. And I think the behavior part is what parents have to deal with, schools have to deal with, society has to deal with. And then there's a lot of extreme opinions on the subject, on what's good, right, healthy, etc. And I think the highlights from the Youth Health Risk Behavior Survey, which has been conducted for about 25, 30 years through the CDC, high school data, which is more or less comparable with Houston high school data, because most states give out such data to the CDC. One does worry about if the first drink of alcohol is taken under 13 years of age, and it's almost comprises about 16% reporting that. Smoking ever falls at around a third, and currently around 9%. And so some of these things you can sort of call experimental. And so experimenting is there's a good thing about it, because you can do it and then get over it. Vaping, a huge issue. And we know that's on the rise as smoking has decreased. And that sits in almost 40% with a lower percent that are currently reported. Then we've got opioid misuse, other illicit drugs, and sexual activity. Ever having had sex falls at around 40%. And then reporting current sexual activity, like over the last 30 days, is about 29%. And maybe only half of that number may be using a reliable form of birth control. So these are the health behaviors that people keep trying to work on with different interventions, coming up with new, improved ways to see how we can help adolescents not move from ever once to chronically using things to handle stress mainly. Moving on. So having given you this background information about morbidity, mortality, et cetera, and what are concerns, I think we have to give more attention to the adolescent brain. I think people who learn about children and pediatrics always learn about development and walking and talking at the right time. And we know the size of our skulls or our heads, per se, what we see of each other is we have that size by age 7, and we call that the age of reason. I mean, these kids at 7 and first grade they can really think, they seem to understand things better. There's a unique wisdom about them at that age. But what happens after that? And we seem to, with adolescents, focus on, well, that's when you start seeing their body starts changing. And we've got to also know what's happening inside the brain. And so there's a study called ABCD, and it's on its, I would say, 15th year, funded by the National Institutes of Health. They've got about 85,000 adolescents that have entered it since the age of 10. Their family members, parents, siblings have all been part of that, and they've been getting MRIs. Functional MRIs to kind of link up behaviors and family history issues. If a father and uncle had this issue, that kind of thing. And so they've collected a lot of data, and the data is slowly coming out. We don't know everything that's been collected yet. So how does your brain grow? I call it that. And so let's move to the next slide. It grows and changes, believe me, and you all know that already, because it's got to mature. And it reaches its biggest size in early adolescence. So early adolescence is in a girl, it starts at 10, 11 maybe years of age. And then you've got in boys, it may be 13, it may be 14. So there's a lag there. And what happens is that there's remodeling of the brain that's been found right all the way up to the 20s. And so even in college, things are happening. And we generally say, if a kid haven't got their act together by the time they're 25, we need to worry. But if there are things that are sort of improving along the way, and by 25 they have their act together, we say, that's good. But this remodeling is going on, and the brain has a lot of plasticity. It's malleable, it's flexible, it's promoting positive aspects of development as well. I mean, we know how bright kids are, and they can study, they can be athletes, they're so creative. But what is it that's got to mature? It's the prefrontal cortex. It's the front of the head, where it's actually higher order functioning, decision making. And for those of you who have to concentrate and think, I know at my age, the best time for me to think it's in the morning, and I want to be really quiet. And you know what, when you're really thinking, you can feel it. It's here. You're organizing your head. And it's that higher order functioning, decision making, and increased myelination has to occur with the change. Next slide. So this is a slide where you've got the 5-year-old brain to the preteen brain, the teen brain, and the 20-year-old brain, and this executive functioning of prefrontal cortex. You can see in the young brain, the yellow, orange, light green is all very much there, more in the front. And you can see how it's changing. And by the time we reach the 20-year-old brain, there's just a lot more fully mature, which is blue. And there's less of the red. And so it's that prefrontal area that's got to mature. So how does that happen? Next slide. So we've got gray matter. And if you've ever seen a cross section, it's hard. I can't put pictures up because of the copyright issues. Those days are gone that I can put up anything. It's very hard for me to find something unless I draw it. So if you slice a brain this way, if you remember, there's all the curly whirly parts of the brain, and that's more white looking. And then in the middle, it's sort of, there's a spine. It's almost like this. And that's the gray matter. That gray matter, it's unused, it's like the transmission center, and it's sending all the messages. Anything that's unused during this time in thinking and processing, it's being pruned. And before they've discovered all of this, the word pruning was used in Alzheimer's. They saw pruning and bundling of things, and literally that is happening during the growth and development during puberty. And it's not a bad thing, it's essential, but it's so important for us to know about this, because all these behavioral changes, when we see this kid not wanting to have anything to do with you anymore, and just sitting in a corner, there's pruning occurring because they're using what they usually use their brains for. They are excelling in it and they want to do that. But extraneous stuff is just going to be pruned for now. Okay, it's temporary. But it all begins here at the back of the brain, and it's the front that's got to be taken care of. So one of the things they focus on connections that are used the most. So it's very interesting, young people have been found with gaming, etc. They're so good at it. And there's nothing bad about that. That needs to be capitalized upon, in a productive way. But if they were reading and they are not interested in reading, that's going to be pruned. The reading components of the brain are going to be pruned. The white matter increases in volume. So like I said, the brain matures inside an already large head. So it's getting bigger. And then the prefrontal cortex gets matured the last. So let's move on to the next section. What does all of this got to do with anything? And we can all ignore it. And but I think it does help in so many ways. If I had to pick an area, it would be attention deficit disorder, hyperactivity disorder. This period of growth can actually make ADHD worsen. But in a lot of these cases, by the time they reach maturity in 25, they've got a handle on it, and they've taken care of it. It's okay. The worrisome ones are the ones that truly started out and they stay. And so that's a whole different condition that's not resolving, and a person has to learn how to handle it. So how does a person handle these brain changes and there's a greater emphasis on the limbic system, which is our emotional center. So we've got the amygdala to anything so the temper tantrums come up, right? Mothers complain about daughters, I can't handle her anymore. The simplest thing, she has a temper tantrum. The emotions take over, you become impulsive, aggressive, instinctive behavior. And then at the same time, the hypothalamus, which is a small little area that's sitting right deep near the pituitary, controls the pituitary, the hormonal system kicks in and everything's kicking in at the same time. So also, as part of that, do you know when the hypothalamus starts kicking in and actually activating? It's when a teenager sleeps. That's when all the hormones start kicking in to help you grow your breasts and make your ovaries start working, or your testicles enlarging from the center. That's why teenagers sleep, and they need sleep. And it's been deemed at least 9 to 10 hours of sleep. Concrete versus abstract thinking, it's how you think. Do you think of only things literally? You'll see that a lot. And you might have to get the answer to a question in 3 different ways. For me, it would be, have you ever had sex? No. When was the last time you had sex? A long time ago. Was it yesterday, last week? Was it 3 years ago? Because a long time ago for me is 3 years ago. No, it was yesterday. So time aspects of abstract thinking and concrete is very much a part of this growth and development of the brain. There's such an emphasis during this time on social rewards, your peers. You want to please them. And it's very hard for you unless you can be in sync with your peers and be on the same so-called value systems, that the rewards you seek could either be negative or positive. We know that moves on to a feeling of autonomy and identity as you grow older. And I think by the time you're 20 or 21, it's sort of there. And then you become more future oriented. So I spend a little more time on the brain because I think this, again, with the background, when you look at mortality and what makes people die, there certainly is a connection here. Next slide. So again, with this background of parallel ideas that I've been presenting to you, I'd like to move on to what I've been doing as a living. Next slide. And that is health and wellness recommendations. What do we say as physicians? Now, I mentioned earlier that someone like me can't do without you. At the same time, what we like to say is, hey, can I just a little itsy bitsy bit be a social worker inside of me? Can I be a psychologist inside of me? Can I be a dietitian inside of me? The more you can integrate knowledge from other disciplines, regardless of your primary discipline, the better you'll be with this age group. And similarly, there are people who get a master's in public health or a doctorate in public health, and they focus their efforts on teenagers, but they do need to integrate medical information. So I think that's where I come from and say, what are health and wellness recommendations? I need to keep an eye on the time. Okay, what is health? It's only more recently that this became a longer sentence with a connecting word called and. When I was being trained, health was absence of disease, boom. Now it's and having a healthy mental state. Guess what? This thing that we have inside our head supposedly has greater importance today. And I don't think anybody will disagree. But there was an era when people disagreed. They said, you should be able to have just control of yourself. And this just happens to be like the little toe on your foot. When if you've injured your little toe, you know that it's a problem. So what is wellness? Wellness expands it, that whole idea. It's an intention and attention to all areas of one's life, living a healthy lifestyle and achieving your full potential. So that makes it a bigger issue. And I think this is where, again, one can argue about the pros and cons to the elements or the constructs that come under wellness. It actually has become rather political on what wellness really is, because it just does fall into aspects related to privacy and confidentiality. And I'm only going to focus on minors and teenagers, because it's a big deal. Let's move on. So this picture that an adolescent or the individual sits right down there in that lower bottom circle, and that human being has a knowledge, has an attitude, and has some belief systems. It's greatly influenced by all these concentric circles around it. The interpersonal, that's the family, the friends, the peers, the social network. And then you've got organizational. So people start, families say, well, it bothers me which school my child A, B, C, D, or I'm going to cause that organizational component is not for me at all. And so I'm a good teacher. I'm going to from my kids. Can create their own little community, and that is the field as any public policy that influences any of these things. Next, and that was called the socio-ecological model. As a physician, it's very important that people understand that the bedrock that we operate on in adolescent healthcare. And for example, I have representatives here from women's health, and they are going into the classroom and they are teaching. The question is, on what rights do they operate? and to what degree can they be communicated. It's actually can be different for me, but that I don't assume. Next slide. So I've got a whole mental health and substance abuse. These are the columns that I think most people want privacy for. The Texas Family Code and Texas Family Planning programs, so that's state-funded programs, say for birth control, parents must consent. Okay. A minor cannot go seeking birth control in any place where it's state funded. And those places need to be really upfront about it. All the other aspects, whether it's pregnancy tests, STI testing, the Texas Family Code has had it written for decades that adolescents have the right to that. The federal government also funds family planning clinics, and self-consent is allowed there. So, for example, the services that I've been part of are all very state funded. And so we've had to receive parental consent right at the time of entrance, that parents say it's okay for you to talk about birth control and offer birth control, and ask the teenager to talk to the parent about it a little more. You encourage that degree of communication. For those of you who know of Legacy, for example, that's a program that's funded by the federal government. And as soon as you enter that property, it's Medicaid, and you can, and it's got federal family planning funds. They can offer birth control without parental consent. At a hospital with clinics, there's plenty of Medicaid funded patients, and there also you can do it. However, I was talking to you earlier about the art of medicine. People talk about the art of medicine having been lost. The fact is that I have actually never, especially with a young adolescent, just willy-nilly done whatever I please, writing on a law, saying boo-hoo to a parent who's brought them in. So it's an art form on how you can encourage communication. And in the end, most parents know what's going on, because that's what you want. As part of this, if there's one thing that I would like people to know, and that is we also strongly encourage a physician having the opportunity to meet with an adolescent by themselves. And that's where you may actually find there's some separation anxiety issues that do occur. The teenager doesn't want to be alone. A mother doesn't want to be alone either without their child. And that's okay. We don't battle it. But we do have, especially starting at around 14 or 15, you have boys and girls who want to be by themselves. And if you can begin a visit talking about how you operate, how you do respect a teenager for their independent thinking, their privacy, and then what are the conditions that I would not be able to keep something private? And that would be if I know that they're going to be of harm to themselves. For sure. And harm to themselves also includes not keeping secret that you've been sexually abused or somebody's been physically abusing you. That their life is in danger. We cannot keep that. And so all of that gets discussed in front of everybody. And actually, a lot of parents are quite relieved that you're going to spend a little time, because they say their primary care physician never does it. And it's all about the time that you've got to spend with your patient. So that is part of it. The biggest challenge we have with regard to consent and confidentiality issues really has got to do with all the electronic medical systems that we now have in place, and how does technology respect a domain that's respectful of a teenager's privacy, like that a test was taken a test result is there for something that falls into STI testing. And if a parent is by law supposed to access test results on my chart, how do we keep it separate? And I have to tell you, that can take about a year of battling with the technical people and the administrative people who love to go on aspects that, you know, it's sort of one of those laws you may or you may not. So people in my field are actually, we eat by barbed wire for breakfast. We have to be so tough, insisting that that has to be respected. And there's no way out towards that, because there are a lot of systems you will find that don't bother. And a lot of teenagers basically shut down. They don't say anything to anybody because they don't trust a system. So that's the reason for me putting this busy slide up, just to highlight what parents have to consent to with state-funded programs. And then also some of the challenges that we face related to electronic medical records being kept confidential and access to information easily. Next slide. A medical history is essential. It's really essential. And if there's anything I would ask parents, and those of you who work with teenagers and you know they're going in for an exam, is I think it's really important for teenagers to learn more about their family history. It's a really good time to learn about family history because we really do depend on good family history. Past medical history, yes. Allergies, I find a lot of teenagers know about every single allergy because they suffer from it. And any medications they may be on. But we always ask about herbal medications as well. Those could be taken more than what I would call prescriptive medicines. So we do need to know about those as well. And what is significant genetically? And your parents are important, your siblings are important, your parents' siblings are important. If we have time, we go into grandparents as well, but really we go backwards and not just say, so your grandparents and your parents and then you. Your uncles and aunts are important. Does your mother or sister have breast cancer? That becomes important. Parents and siblings, anybody with diabetes, colorectal cancer, and anybody less than 50 years of age, high blood pressure among these individuals, heart attacks under 55 years of age in a father or a brother, and in a mother or a sister, it's under 65, the higher risk there. And then there's strokes. Why does this become important? Is in birth control pills, and birth control pills are normally very safe. They are. But at the same time, one shouldn't just take that as the overriding situation, because there is a genetic piece that's present in certain families where a father had a heart attack at 40. There was an uncle, a father's brother, who had a heart attack. They lost their father when they were very young. And that gene, it's called factor V Leiden, that predisposes them to a heart attack. It could be that if a girl goes on a birth control pill with estrogen, the estrogen will raise your risk of stroke as a result of factor V Leiden. Is this common? Absolutely not. But I don't even want one of my patients going through this. So actually in our setting, we might actually test somebody when we get this background history. We say, well, you know, you're probably going to be okay, but let me try you first on a birth control that doesn't have estrogen. We'll get this test done. And because you prefer the pill, which I don't support anymore because it's not as reliable, the pill, you've got to take it every day, as opposed to getting an implant in or an IUD, which is only progesterone. I'm going off track a bit, but that's the reason to get a good family history. You don't want to miss a few things that are rare. Next slide. Knowing about periods is really important. It's interesting. I have a dual membership, both in pediatrics and obstetrics and gynecology. And our field was the first field that said, when we were inundated with teenagers with menstrual problems, why is this only an obstetrics gynecology field? And it had become a sacrosanct field area that only an oncologist should be asking about periods. Well, that's all been thrown out the window. And we in pediatrics, even a resident in pediatrics, needs to know about period. It's called the third vital sign: blood pressure, weight, periods. In medicine, that's the third vital sign. It says a lot to everybody. So the mean age is about 12 and a half. And we like to, we need to assess whether it's early or late for a young girl. And it's been lowering in age. So in certain groups, it could be as early as 10, and it may be familial. Or it may be because of being overweight or obese that they got their periods early. And so knowing what age you started your period in a girl it becomes important from a medical standpoint. Next place. From a social history standpoint, I usually, we have a mnemonic called HEADS. And it actually covers everything that we saw earlier that we listed in morbidities and health behaviors. And we go through all of that. And that area is also kept confidential in a record. And we've managed to close it off. So you can see it's home, education, employment. By the way, on employment, the labor statistics, it's been shown there's actually a pretty close connection between young people in high school working greater than 20 hours a week. And some of them, when I used to work and have a clinic, they'd be working 30 hours a week, and they were juniors in high school trying to make it. And what do they do to stay awake? They could get to drugs, trying to handle both lives. So it's trying to work with them about keeping it 20 hours and under. Diet, we know that anorexia nervosa, eating disorders, is the other spectrum on the other side that we need to pay attention to with diet. Drugs, drinking, smoking, sex, sexuality and gender, suicidality and mental health, and safety and abuse. All of these fall under HEADS, and we go through that. And every medical student, when they work with a teenager, is taught this mnemonic. Next slide. What are the things besides what I've just mentioned in terms of behavior that we do? We've addressed medical social history. We've identified obesity, if it's an issue, depression, we've identified. So it isn't just asking if there's a problem. We've got to address these issues as well. And so the counseling piece also comes in as to what they want to change or what they don't want to do. So there is counseling about sexual activity, pregnancy prevention, violence and substance abuse. Annual chlamydia, gonorrhea testing is recommended in a sexually active adolescent. Doesn't matter where they live, okay? Pap smear is only recommended when you're 21 years of age and older. It used to be a norm earlier than that, but it's all been ruled out. HIV testing is offered. Anemia is normally done a lot every year by private practitioners, but it's not really necessary unless you see huge, the intention to lose weight and or being overweight. That's where it may play a role. Lipid screening, metabolic panel, hemoglobin A1C to screen for diabetes are all done as a standard if you are obese. And that's usually when your BMI is 30 or greater, okay? Hearing and vision, the standard really is if they can't hear you while they're in the office, that's when you recommend it. However, the qualifiers that Medicaid, if you're funded by Medicaid, they insist that that also be an annual evaluation. TB tests used to be done a lot. It's really all high-risk exposures now. So if you're working in a hospital, you got to get them done every year. Now it's also, that's being changed. As you know, we work a lot on vaccines, and flu is very much a part of an annual vaccine. If I had to pick what your time gets spent on vaccine for adolescents and young adults, it's catch up, because there should have been a completion of series by the time you're 15, and it hasn't happened, so you play catch up. And the big one, it's a little different. So for example, HPV, it'd be nice if you could get your 2 doses before 15. Otherwise, after that, if you start from scratch, it's 3. It takes longer to take care of all these catch-ups. And then the meningococcal vaccine, meningitis is a terrible condition to have. One needs to look at college-age students living in residential halls, dorms, etc. It's that overcrowding. And so it's in your the older years that you're more susceptible. As a result of that, you prepare an adolescent for that period, and you want them at 16 to get their second dose because they should have gotten their first dose for the main meningitis vaccine when they were 11. So that's on a catch up. It's 16 is the second dose. However, also, Men-B is one that is given between 16 and 18 for 2 doses, and it's not for now, it's for your college years. And it was, hey, would you like to have it? What's happened now is, I don't know about U of H here down on campus, but I think it's no different from the main campus. It's not any difference from the other colleges. They insist on Men-B at entrance. You can't get into college without having these various tests. And if you're going to go into technical courses at a college, you're going to be asked to get a TB test because your environment is going to be more of a hospital clinic-based system and exposure to high-risk people. So, and varicella, which is chickenpox, it's all catch up. Almost done. What I did want to bring up was, when do we consider pubertal development alerts or red flags? So if a girl develops breasts under 8 years of age, one needs to rule out and make sure, okay, is it just physiological? Is it familial, runs in families? Or with the immigration of people and the various contaminated foods that are present in agricultural life, etc., there are hormones that are used in animals and in plants, etc., that are the cycle, and you can have early breast development. So those things, delayed breasts is a very big issue. You worry about if there's no breast development by 13 and a half. If there's no breast development and no menses, you need to go to a doc by the time you're 14. If you've got and no menses, then it's you can wait till about 16. But there are different medical causes that need to be tested for and looked for. In males, it's a little unusual to deal with precocious, meaning early onset of puberty. But if there is testicular enlargement before 9 years of age, one does need to get examined by a doctor. Delayed development is quite common, and it can be familial among the father and the mother. They tend to be taller people. If you once testosterone kicks in, it actually you grow, but then you stop growing. And if you have delayed testicular development, you're just going to keep growing. So one just needs to prove that it's a familial issue. Next slide. Let's move to the next slide. I'm just going to move on because I think where I wanted to end was I think we know and can suspect what from a social standpoint when one gets worried about teenagers. So I didn't want to focus too much on that. And I think most of you know about positive youth development, because one of the things for me is when you talk to parents and a parent says, no, I'm not worried about him. You know, he doesn't drink and he doesn't smoke. And what one has to really turn it around and say, well, that's really good. It's the doesn't. So tell me some nice things about some other things or positive things about your child. So in terms of connections, do they have friends? Do they participate in the household with things? How confident is he or she? Do you think that he's trustworthy? how competent, the contribution. We work on these for the rest of our lives, but these are qualities that start off in the young years, and those are the more positive aspects of youth development that people build on, and suggest that in studies that engagement and connections in at least two of the following, could be school, peers, athletics, employment, religion, culture, at least two of these, and it makes a person develop positively. I'd like to end with the president of the Boys and Girls Club of America, which happens to be a positive youth development program, talks about how young people today need to build essential soft skills. And the soft skills are conflict resolution and team skills, because they're growing up in a 24/7 online world, and the outsiders and the adults don't know what's happening. So in silence, how do you learn those soft skills? There's a lot of bullying that goes on, but nobody knows about it because they don't report it. If it's overt bullying in person, that tends to get reported more. So it's the soft skills that focus on, and if we can be less judgment about what's going on and make them feel comfortable to talk about tough topics, that's how I'd like to close. Thank you so much again for inviting me. Right there, we have a few questions.
Okay, so if you have any questions for Dr. Chaco, please go ahead and put them into the chat at this time. We would love to hear any questions that you have. I'm going to go ahead and pull up the chat on my end, but we do have a few questions from the room. Okay, so one question was, when you were talking about some of the health problems that are commonly in adolescents or found in adolescents, are they due to lack of education in school curriculum? Can you attribute any of those to maybe a lack of education?
Yeah, I think that's a very political question, actually, because it's all about what people think needs to be taught in school. And I think as long as health is considered an important curricular topic, it's what needs to be taught about health. And if you're going to talk about health, I think having one session is not enough. But if you're going to do it in high school, for example, or it's pertinent to them. And I think the most important thing is that it doesn't matter where you live or what religion you belong to or whatever. I think the general knowledge on what adolescents are exposed to and at risk for and how to handle them, also regular medical health problems need to be addressed.
Thank you. The next question was, do you think social media plays an impact on adolescent health behaviors? And if so, how can we reduce some of these negative behaviors?
If I knew the answer, I would, and if anybody knew the answer, it would be terrific. I think I'd just like to begin by saying, from what I can see and hear, because I've got some friends who are school principals, they're totally overwhelmed with how to handle this. It's in cancer, you call it metastasizing something. There's an invasion of the whole body, and here it's there. So part of it is, how do you, do I blame social media? I think the big issue is that it's here to stay. Number one, if we think it's all going to go away, it's not. But how can we learn or manage it for the children so that to cut down on all the interpersonal stuff, because it's the silent piece that I was mentioned earlier that's going on, that actually in school systems they're having to deal with, because there are these insults, etc. So what's the language that can be used? Because there's a lot of, it's given permission for people to say anything they want, and it's destroying people's lives. So I don't have an answer to that. From a personal standpoint, I do know families and the younger, with their younger middle school adolescents, and maybe also with freshman year, they're monitoring. they're monitoring what they're doing online. And so it's sort of an end of the day evaluation. And there's an agreement that you have your phone, for example, based on the fact that at the end of the day, we're going to be looking at what you do and say, just it's for your safety. So it's all built around safety and not that we want to snoop. It's not about your character and you're a good or a bad girl or boy. I don't know if that helps.
I think it does. Oh, yeah. What about the brain development?
Yeah, I think what we are seeing, a lot of what you see is impulsivity and emotional reaction. And if you look at what our brains are capable of doing during those early years, there's a lot of impulsivity and extreme reactions to things. So there are some comments that you would normally even hear verbally, and you're oversensitive. So you've got two extremes of that emotional emphasis.
We don't have a question in the comment box, but we do have a comment. It says, Dr. Chaco, you and I worked together years ago in a partnership at Lee High School, which is now Wisdom High School, at the teen clinic. Thank you for your continuous dedication and devotion to our youth.
Oh, thank you.
That was a very lovely comment. I have just one last question that I like to ask at the presentations, and it is this: if you were to give us one final piece of advice or one final takeaway, something that you want us to really have stick with us from this presentation, what would that be?
Personal life, because personal lives do come into question. I really, really think that today it's working parents and how working parents can navigate through all of this and give their children the same opportunities that they were afforded. And women who are, or men who are working, who are at home and looking after their children, we can't assume that they also know it all just because they're there. So it's the communication and it's the meaning of every moment of family interaction that you can make something out of nothing, you know. Well, just 5 minutes? No, let's do something in 5 minutes. I think that's the big challenge, and that people have, that I would say that we all have to work very hard on, that we value time despite all our busy lives, and that we want to be together and learn from each other as a family. It really is the nexus for the future.
Well, thank you so much. Thank you.
Thank you so much for having me. Yeah.
That was wonderful. As far as the Women's Fund goes, if you can advance this slide. I just wanted to thank you all for tuning in. I hope that you enjoyed the presentation. If you're like me and you think of questions after the fact, you can always email us at healtheducator@thewomensfund.org, and we will. Or if you have any comments or feedback, we would love to hear them. And then I also have our survey link and the QR code to the survey if you're interested in providing us with feedback over today's presentation. We definitely welcome that. And then lastly, this is just our social media handles and our website. If you are interested in learning more about the Women's Fund or any of our upcoming organization, I encourage you to check out these sites. And then on December 7th, we have our last presentation of the year that will be open to the public over Happy Healthy Holidays. So if you're curious to know how you can be a little healthier this holiday season, I encourage you to tune in. It is a hybrid event, so you have the option to come in person or to join us virtually. And that is all I have. Did you have any final words?
Well, we thank everyone for joining us. For those that are online, if you could just let your instructor know that you were here. If you have other questions that weren't answered, send them to me and I'll forward them on to Kayla. Everyone have a great afternoon and thank you so much, Dr. Chaco, for joining us and for your expertise.